Thank you very much, Akuya. It's great to be here to present the unique attributes of the CDMRP cancer programs. Next slide, please, Sarah. So the CDMRP has a long tradition of funding cancer research. It all started back in 1992 with the addition of $25 million for women's health to the Army appropriation. And following that in 1993, there was even a larger chunk of change that was moved towards breast cancer research and establishing the CDMRP. And it started the cancer research programs overall. Each one of these programs, there's 10 of them here, either are cancer programs outright or related to cancer, such as bone marrow failure, which can lead to cancer. Each one of these programs are unique and separate. That is, they have their own vision, they have their own mission, they have their own investment strategy, but each and every one of them are trying to fund innovative and impactful research to eradicate cancer. Now, you may wonder how cancers can be relevant to military research. And I've often received that question. Does this cancer have to be specific to the military? Number one, the military is filled with people, and there are no cancers that are specific to the military per se. But what we do have here is cancer causing and influencing mission readiness, affecting mission readiness. And when you affect mission readiness by either taking a service member or a member of their family as a person that has cancer, what happens then is that you have a force vulnerability. So any cancer can be military related. Let's go to the next slide. What I'm going to do now is I'm going to go through some of the facts and figures for the cancer programs. You saw the slide that Akuya published that showed the different types of appropriations for fiscal year 21. And that's shown here as well. But I did want to point out when each one of these programs were established, breast cancer being the first to be established. Each one of them has established over the years and having different appropriations. For instance, bone marrow failure was established in fiscal year 2008. It has had an appropriation since FY21 of 7.5 million, and its total appropriations through FY20 is about $42 million, and it has 82 awards funded. So each one of these programs are differing in size and therefore also differing in how they're going to expend their funds. The FY22 appropriation is still waiting for the appropriation to be passed. So let's go to the next slide. I'm going to go through each one of the 10 different programs and give you the highlights, essentially. The breast cancer research program, as I said, was the very first program, and what their vision is a world without breast cancer. How are they going to do this? They're really doing this through innovative and high impact research with a partnership of scientists and consumers. Akuya introduced you to consumers as lay people that are affected by the cancer. The way that the breast cancer program is really trying to eradicate breast cancer is through their overarching challenges that span the gamut of different areas of breast cancer that really are in need. Prevention of breast cancer, for instance, distinguishing those deadly breast cancers from non-deadly breast cancers, looking at dormancy and metastatic breast cancer. Metastatic breast cancer is a really hot topic, and it's really where a lot of the focus is, because we can treat metastatic breast cancer, but we cannot cure it yet. So I think that that's really important to pay attention to. And one of the things that breast cancer research program is really trying to do is revolutionize treatment regimens and eliminate that metastatic mortality. And that's what's shown here in their funding of the different overarching challenges that they have. Let's go on to the next slide. In this slide, you'll see the anticipated funding opportunities for FY22. Each one of these have program announcements that are that will be published once we have our FY22 appropriation. Each one of these are different in its unique characteristics and intent, as well as its what are its requirements. So you have to read the entire funding opportunity to really understand what, for instance, the breakthrough level 4 award is, as opposed to the breakthrough levels 1 and 2. 1 and 2 are more basic, 3 and 4 are more translational into clinical trials. High impact advances resulting from breast cancer funded research includes 6 FDA approved drugs and devices. And I want to make a point of the fact that breast cancer research program really changed the way clinical practice happens these days, in that the breast cancer program did the first studies in sentinel node biopsy, as well as the very early studies that would lead to Herceptin, which is really a miracle drug for those with HER2 new positive breast cancers that are very aggressive. Let's go to the next slide. Bone marrow failure research program is a program that started in 2008 with only a $1 million appropriation, but they've done quite a bit with their smaller appropriations. Bone marrow failure is like myelodysplastic syndromes, for Fanconi anemia, aplastic anemia, and so on. Each one of these can lead to a risk of developing cancer. To understand the bone marrow failure research program, though, you have to understand that they really want to focus in on the bone marrow failure part of it. They will fund studies that move towards how bone marrow failure leads to cancers, but they're not looking at just studies that are primarily looking only at the cancer itself. For instance, MDS, myelodysplastic syndrome, can lead to AML. They're not looking for studies in AML. They're looking for studies in MDS that may and how it might progress. So it's really looking at that risk factor there and how that happens. And they're really trying to encourage and support innovative research that's committed to understanding bone marrow failure, both hereditary and acquired. Let's go to the next slide. Kidney cancer research program started in fiscal year 17. And it really is one of those progressive type of cancer research programs, in that it leapt in with both feet. And what I mean by that is they really wanted to eliminate kidney cancer through collaboration and discovery. They have these 4 overarching challenges that's really trying to understand the basics of research while improving patient care. And one of the things they've done is to really double down on that collaboration and discovery. So let's go to the next slide. Here we have what the Kidney Cancer Research Program is really trying to do here. They're funding a clinical consortium for a program that's so young, only from 2017, to fund a clinical consortium and try to push towards those treatments. It's fabulous. Also, they acknowledge that kidney cancer is one of those smaller cancers. You don't see a lot of people focusing down on kidney cancer. And so they are really trying to move to fund early career investigators. So that's something that they really want to do. You can see the award mechanisms that were offered in fiscal year 21. The fiscal year 22 will be coming as soon as we get our appropriation, and you can find that information on the website. Let's go to the next slide. The lung cancer research program started in fiscal year 09. And when we look at the lung cancer research program, we look at, eradicating deaths and suffering from lung cancer. And one of the things that we're really seeing nowadays is a drop in mortality from cancers. And that's mainly because of lung cancer, and mainly because of a decrease in tobacco use. But wait a minute, we really want to pay attention to this, because not all lung cancers are due to smoking. So while we do want to look at smoking and how it can attribute to lung cancers, we also want to understand contributors to lung cancer development other than tobacco. We want to know innovative prevention strategies, as well as the mechanisms for initiation and progression. The lung cancer program has been able to support publications, as well as looking at biomarkers and tools licensed to the industry. And they're looking at 4 patents have been generated with 10 patent applications. Let's go to the next slide. One of the things that's really interesting for lung cancer research program is that it did do a detection of early lung cancer among military personnel clinical consortium. So they have put a large portion of their money into this clinical consortium in order to detect earlier lung cancers, because we all know that with cancer, the earlier you detect, the higher the survival rate. The anticipated funding opportunities are shown here, where you have early concepts like the Concept Award and Idea Development Award, and the Early Career Development Award as well. But you also have those ones that are more mature, like Investigator Initiated Translational Research Award and Clinical Translational Research Partnership Award. They've contributed to 10 treatments now in clinical trials and two licensures for the detection of biomarker panels. Let's go to the next slide. The melanoma research program started only in fiscal year 19, so it's fairly new, and it's quite different in some regards than some of the other cancer programs that is looking at under CDMRP, in that what the melanoma research program really is doing is it's challenging the research community to redefine the concept of prevention, and to include the entire spectrum of melanomagenesis. And that is, when we think of melanoma, we think of, oh, put on your sunscreen, put on some protective clothing. Well, not all melanomas are generated because of skin damage from UV irradiation. There are melanomas such as acral melanoma, which is in your fingernail beds or your palms of your hands or soles of your feet. There's mucosal melanoma, which is in your mucosal areas of your body, as well as ocular melanoma, which is your it can cause blindness. So there's multiple types of melanoma, and we really want to look at the disease process from initiation to metastasis and really look at how to stop melanoma or prevent melanoma initiation and progression. Let's go to the next slide. Ovarian Cancer Research Program is one of the historical or legacy programs. It started in 1997. As you can imagine, Ovarian Cancer Research Program is really one of those programs that is really trying to make a difference in ovarian cancer. Ovarian cancer has a low survival rate, and also it has a smaller amount of money that's dedicated to it overall in the federal government. So in order to do, so that means that very often what we see here with ovarian cancer is that people will be studying some other cancer, for instance, like breast cancer, and do ovarian cancer on the side. They're not 100% dedicated to ovarian cancer. So what we're trying to do here is to eliminate ovarian cancer but also looking at different areas that are really important, like prevention, detection, and diagnosis. If we diagnosed ovarian cancer earlier, in stage 1, the likelihood of survival would be much higher. So, but also what we find is those investigators that are not 100% dedicated to ovarian cancer, because there's not enough funds in ovarian cancer, to be honest. So what the Ovarian Cancer Research Program did was develop a very unique award mechanism. And let's go to the next slide for that. And that is the Ovarian Cancer Academy. And this is dedicated to looking at early career investigators, going into early career investigators, getting an infrastructure for them to interact with one another and also collaborate with leaders in the field. And this allows these early career investigators a support network that will allow them to continue on in ovarian cancer and not drop out of ovarian cancer research. So as you can see, we have 14 alumni that are still doing ovarian cancer research and 15 current ovarian cancer early career investigators, part of this network that will push them and move them forward to be successful established ovarian cancer researchers. Let's go to the next slide. The next slide is the Pancreatic Cancer Research Program. As we all know, pancreatic cancer has taken the lives of some very, very famous people in the last couple of years. And that's the reason why is that pancreatic cancer is one of those cancers that has a very low survival rate, less than 10% for 5 years. In order to diminish the burden of pancreatic cancer amongst veterans and their families and so on, really have to promote rigorous, innovative, high-impact research. So the Pancreatic Cancer Research Program was established in fiscal year 20 with these focus areas. And what they're really looking down on is to diagnose pancreatic cancer earlier. Most pancreatic cancer is diagnosed in stage 4. And by then it's really too late. Most people succumb to their disease within 2 years. So really what the Pancreatic Cancer Research Program is doing is dedicating monies towards detection, supportive care for patient-related outcomes, understanding the relationship between metabolic disruptions and pancreatic cancer, and even understanding that pancreatic cancer metastasis. So this is a very early program, very early on, and its strategic plan you can see on the website to get more information. Let's go to the next slide. The Peer Review Cancer Research Program is the one of the programs that's near and dear to my heart because it's the program that I am the program manager for. And really what we're trying to do is to advance mission readiness of those U.S. military members affected by cancer and to improve their quality of life by decreasing the burden of cancer. Now, this cancer research program doesn't have a specific cancer in the title, okay? And that's because congressional language designates the topic areas that will be included each fiscal year. For fiscal year 21, you could see the number of topic areas that we had. We had about 20 topic areas. I want to make a very clear point here. All of the other programs that I'm talking about today with cancer research programs that are under CDMRP are not under the Peer Review Cancer Research Program. These are cancers other than those. So those cancers, breast, kidney, lung, pancreatic, prostate, ovarian, rare cancers, and melanoma all have their own standalone program. Congressional language says we're not funding these cancers under this peer review cancer research program. We're funding all of these other topic areas for this year. Over the years, we've had 34 different cancers in research areas underneath the peer review cancer research program. Research must be relevant to service members and their families. And we do have a video on how to approach that as well on our website. The FDA, we have an FDA approved treatment for blood cancers. There is some phase 2 clinical trials moving forward, as well as looking at advances in multifunctional nanotechnology to enhance therapeutic delivery in pediatric brain tumors. We're also very interested in looking at Convergent Science in cancer research. So let's go to the next slide. Much like the Ovarian Cancer Academy, what we decided to do for the Peer Review Cancer Research Program is to look at Convergent Science, bringing together these early career investigators, what we call scholars, from different cancers, from blood cancer, brain cancer, bladder cancer, and so on. All of these are together, all of these different people are together, and they're doing different disciplines from genetics to psychology to microfluidics and so on. We're going to cross-pollinate this, bring them together so that they can interact with one another, learn something new, stop stovepiping them so that they can cross-network and bring together that idea of convergent science to have the skills and awareness so that they can collaboratively leverage the power of convergent science. So let's go to the next slide. Prostate Cancer Research Program started in 1997, so it is one of our legacy programs, and it is really trying to conquer prostate cancer. And one of the biggest things about prostate cancer is whether or not the disease is indolent or whether or not it's aggressive and a lethal prostate cancer. And trying to delineate the two is really one of the focuses of the Prostate Cancer Research Program. And also what they really want to do is advance health equity and reduce disparities in prostate cancer, because there are racial disparities that lead to a higher mortality rate in the Black population. So the Prostate Cancer Research Program is aware and cognizant of that and put out an overarching challenge to push that as well. One of the things that the Prostate Cancer Program has also done is to fund a clinical trials consortium that has been moving the field forward in leaps and bounds, putting 6 different FDA approved treatments that have been led by the consortium. So the next slide, please. The Prostate Cancer Research Program award mechanisms are shown here from FY21. New ones will be available. Probably the announcement may be available in sometime in the next couple of months. You can see the appropriations over the years, how many presentations, publications, and patents, and also that there have been other FDA approved drugs that have come out of the Prostate Cancer Research Program that are not just part of that consortium. So it's really moving the field forward in leaps and bounds. Let's go to the next slide. And the Rare Cancer Research Program is a program that started in fiscal year 20. And rare cancers are those cancers that are, off the beaten path type of cancers, the kind that you don't really hear about. And they have defined rare cancers as those that are 6 or less in incidence per 100,000 per year. What they're looking for are basic research studies, but also to support collaboration and infrastructure, because any type of rare cancer or rare disease does not have the infrastructure and the resources that are necessary to do the research. So one of the things that the Rare Cancer Research Program has really focused down on is the development of platforms to actually go into this and to get this information from centralized databanks, patient registry, and so on, and research models for multiple cancers to share the data across the field. And so they're really looking to improve outcomes for people with rare cancers through discovery and community building and expansion of knowledge across the cancer landscape. Next slide, please. So these, once again, these are the cancer research programs that are under the CDMRP. You can find out more on our website, and each one of these have a lot of information that you can kind of get the idea of the intent of each one of the programs and where you may fit in. Now, I'm just going to quickly go to the next slide. And this is just the FY21 topic areas for peer review cancer, larger so that you can see them better. But I'm going to go ahead and see if there's any questions in the chat for me. Okay, there aren't at this time. Oh, wait. Is brain cancer a CDMRP priority? Brain cancer has been under the peer review cancer research program for several years now, both adult brain cancer and pediatric brain tumors. So yes, it is a priority for the peer review cancer research program. Thank you. Eye cancer, uveal melanoma is covered under the melanoma research program. So you can find it there as far as uveal melanoma is concerned. Other types of eye cancer would be under rare cancers. Neuroendocrine tumors, part of rare cancers, yes, it is. You can also find neuroendocrine tumors under like pancreatic cancer as well. And we have another question that says, are the programs funding therapeutics only or also diagnostic tools. Each one of the programs have their own different challenges and focus areas that you should look in and see what they're looking at. I know, for instance, peer review cancer and melanoma are looking at diagnostic tools and therapeutics. Melanoma more so to stop melanoma in its tracks before it gets to metastatic, but peer review cancer is looking at therapeutics across the entire spectrum of cancer development and carcinogenesis. So it's therapeutics and diagnostic tools for peer review cancer. Each one of the programs, you should take a look at it and see what they're doing and what they want to actually get an idea as far as that's concerned. Thank you. Are there any other questions? I know that my colleague, Akuya, had to leave for family priority, and I would be happy to answer any questions on the general CDMRP. We do have another question for melanoma. Can preventing progression be separate? I'm not exactly sure what that means, but I'll give it my best shot. Preventing progression, if you have progression towards metastatic, yes, that can be funded. They really just don't want it only being about the metastatic state. They want to fund earlier than that. Likelihood of success for CDMRP versus SBIR, STTR, NCI applications. That's kind of a complex question because CDMRP has different funding rates. I know, for instance, for the peer review cancer research program, we can have funding rates in different cancers that are up to about 50 or 60%. But I don't know what the SBIR, STTR, NCI applications are right now, what their funding percentages are. So we do try the different cancer programs, and you have to look at the different cancer programs and also look at the different funding opportunities. Some of the opportunities, like the more basic ones, like IDEA awards and so on, will have lower funding rates, but there will also be higher funding rates for the ones that are more specific. Does CDMRP fund illnesses beyond cancer, like encephalomyelitis? Yes, you can actually look for that under the peer review medical research program that Akuya actually talked about. Can we apply to them all at the same time? Each one of them are released at different times during the year. You cannot apply to every single cancer program with the same project. That's not going to work because each one of them have a different intent and different needs. So you really should tailor it to the program. So there are, and Sarah's going to talk about neurological diseases. So you'll see that CDMRP does fund quite a bit of neurological areas, illnesses as well beyond cancers. And I'm going to go ahead and change it and shift it off to you, Sarah, and thank you for doing the slides.